if you take nothing from this lecture today, just think about, I want you to just have this in your brain. So when you go to do a quad set, you're trying to recover quadriceps contraction capability. When you do that, we normally think, okay, it's going to improve range of motion for knee extension. It's going to recover maybe overcome some of the inhibition, and maybe we'll get a little hypertrophy effect, right? Because maybe it's a loaded contraction or whatever. You're really obsessed thinking about that. But what I want to challenge you to think about is every contraction they generate, they pull information from every region. Premotor cortex, motor cortex executes the plan. And so if you think about how those regions are activating in like a clinic environment versus how they're going to activate on the field, you don't really want them, it's mostly inconsequential if you recover quadriceps activation in the moment in that therapy session. You need to have them have high quadriceps activation outside of your therapy when they're engaged in the world. What we do in that session is we allow them to focus on the quad and generate a muscle contraction. And we discredit what the entire rest of the brain is doing. So this will make a lot more sense when I get to the therapy implications of some of our data. But I just want you to think about all of your exercises, how you prescribe them, and remember that all of the other regions play a role. So the stimulus you're giving cognitively, visually, auditory, all get incorporated.